we're back with Harmon. Harmon had a C-section 2 weeks ago. She looks phenomenal, and she brought her baby. We're keeping baby turned. She's really cute and a little peanut. Today what we're going to talk about is the instruction that women are given post C-section that isn't exactly thorough and isn't exactly helpful. And we're talking about today is how a patient can misunderstand the instructions from their provider and think, I'm not going to do anything. In the reality, we have this carrier with a baby in it, and even I'm pretty swole. It's heavy, right? And you're carrying this into a car, you're reaching into a car in awkward positions, and she just had a C-section. So how do you do that? How can Harmon do things so she's able to keep up with this growing baby that's going to grow like a weed in the next couple weeks? So one thing we can have Harmon do is to use what she has. We want to make sure her upper arms are buff and that she's able. This is why we advocate weight training prior to having the baby in some form so that you are strong enough to be able to do bicep curls, which is what essentially you're doing when you pick up the baby. So it's really important to check that out in terms of making sure it's safe with your OB, making sure it's safe with your midwife, but to do something so that even if it's not affecting where you had the C-section, you're able to isolate these abs so the abs are not involved, so you don't affect the major abdominal surgery you just had and still get things done. One of the best things that you can do is to either have a ball or have up against the wall where I'm sort of locking this out. If you have a ball at home, that's the best way to do it, so you're protecting this. But you can take a lighter weight, drop your weight to about a quarter of what you're used to, and do curls like this. It has no effect on here. If you're recruiting where it's too heavy, where you feel you're aware of it pulling into your abs, you want to stop immediately. And a lot of people may come at me and say, like, you shouldn't be lifting any weights. What is she doing right now with doing that? So we need to work around things and not make things worse, but figure out how to get her stronger. If she didn't do any exercise prior to having the baby, what can we give her to have her get stronger as the baby grows?